Unfortunately, there are a lot of YouTubers who try to manipulate you into choosing a Medicare plan that benefits them.
You just want more money.
It's all about the money.
They'll tell you things like 80% of our clients choose this plan to make it seem like the most popular plan. But that's only because they make more money when you think that. But did you know that there's an extremely controversial Medicare plan that has around 19 million enrollees and is 5 times more popular than the plan that most YouTubers are trying to sell you in 2025? What's crazy is that the plan that a lot of YouTubers consider to be the quote-unquote best plan is actually only the 3rd most popular Medicare plan today. Now, I'm not here to say that you have to get the most popular plan or even that the plan that YouTubers recommend is bad. In fact, depending on your circumstances, it can be an amazing plan for you. Instead, I'm here to show you the 4 plans that most of Medicare's 67.7 million enrollees are choosing. I'm going to talk about these 4 plans, why they're popular, and the pros and cons of each so that you'll get a much better idea of which plan may be the best plan for you. The 4th most popular Medicare plan in 2025, with 1,377,952 enrollees, we got to get this exactly right here, people, is the Medicare Supplement Plan N. Medicare Supplement Plan N is popular because it provides what most people would deem as pretty comprehensive coverage. And it's not as expensive as the Medicare Supplement Plan G, which I'm going to talk about more in a little bit. Now, to understand why over 1 million people choose the Medicare Plan N, let's first take a look at a refresher on what Medicare Supplement plans are. You see, Original Medicare has 6 gaps that you're responsible for paying out of pocket. These are the Part A deductible, copays for days that you spend in the hospital, copays for days that you spend in a skilled nursing facility, the Part B deductible, the 20% coinsurance for most services covered by Medicare Part B, and Part B excess charges should you ever need to pay them. Medicare supplement plans act as a secondary insurance to Original Medicare. This means that once Original Medicare has paid its part, instead of passing the rest of the bill directly on to you, it goes to your Medicare supplement plan first. Only once your Medicare supplement plan pays its part of the bill, then a bill will go to you, which usually means that you'll have to pay a pretty low out-of-pocket spend whenever you get covered items and services. Now, there are 10 standardized Medicare supplement plans offering a variety of levels of coverage. But nowadays, most people only choose between the Medicare Supplement Plan N or Plan G because these 2 typically provide the most coverage. As you can see in this chart, Medicare Supplement Plan N covers 4 of the 6 gaps of Original Medicare. It covers the Medicare Part A deductible, inpatient hospital copays, and skilled nursing facility copays, all at 100%. So if you're admitted to the hospital and you're on a Medicare Supplement Plan N, you generally will not have to pay for your stay. It also covers the Medicare Part B coinsurance. However, you will have copays whenever you visit a doctor's office, which can cost up to $20, and copays of $50 if you visit an emergency room without being admitted to the hospital. The Medicare Supplement Plan N does not cover the Medicare Part B deductible, so with the Medigap Plan N, in 2025, you'll spend $257 out of pocket before your Part B kicks in. And now the big one, Medigap Plan N does not cover your Medicare Part B excess charges. For those of you who don't know what this is, Medicare Part B excess charges come when a doctor charges more than the Medicare approved amount. Some doctors are allowed to charge up to 15% above the Medicare approved amount, and you're responsible for paying those excess charges 100%. So if Medicare says that something can cost $1,000, then these doctors can charge an extra $150, which is 15%. In that example, Medicare covers $800, which is the 80%. Your Plan N would cover $200, which gets you to 100%, but this extra 15% or $150 you would be responsible for. So if you have a Plan N and a doctor that charges excess charges, keep in mind that you could have an additional 15% charge that you're responsible for and that your Medicare supplement plan will not cover. Now, the good news is that according to a study by the Kaiser Family Foundation, which is a nonprofit, they said that 98% of doctors in the United States always take the Medicare approved amount. So it's only about 2% of the doctors that can charge you excess charges, but be careful, sometimes it's hard to avoid these. We've seen situations where that 2% happens to be the anesthesiologist in the hospital. And in that case, that's a provider that you don't have the opportunity to speak to sometimes before you actually receive their service. So it's something that you want to consider and look into, because if you have an excess charge, it can get really expensive. Speaking of expensive, one of the downsides of a Medicare supplement plan generally is that your out-of-pocket expenses are low, but your premiums are high. Medicare supplement plans don't have fixed prices. Instead, you'll find that the cost differs depending on where you live, and in most states, how old you are, and whether or not you use tobacco. And sometimes there can be other factors. But generally speaking, you'll find that the monthly premium for a Medicare supplement plan N for someone who is 65 will run somewhere between $80 to $120 a month, and it will increase every year for age. Now, in some places like New York, you'll find that premiums are a lot more expensive than this. That's because in New York, they don't allow increases for age, and so everyone has to pay a higher price. But for a 65-year-old who is new to Medicare, the prices that I gave you, $80 to $120, is generally the price range for most people to purchase a Medicare supplement plan N. Now, if you think that that's expensive, wait till you hear about the third most popular Medicare plan in 2025, which is the Plan G. Yes, the third most popular Medicare plan for 2025, with 4,856,256 enrollees as of the time of this recording, is the Medicare Supplement Plan G. Now, before I get into the details of the Plan G, let me just say that if you're listening to influencers here on YouTube, you'll go away thinking that this is the absolute best plan available. So be careful who you're listening to on YouTube, because they'll tell you that everyone should have this plan. But only 4.8 million people have the Medicare Supplement Plan G, and there are 66 million people on Medicare. Well, the truth is the Medigap Plan G can be a great option for some people, but it's definitely not for everyone. And let me show you why. Unlike the Medicare Supplement Plan N, Plan G covers 5 out of the 6 gaps of original Medicare. In fact, the only gap that the Plan G doesn't cover is the Medicare Part D deductible, which is $257. That means that once you pay the $257 deductible at the beginning of the year, and $257 is the 2025 rate, you're essentially covered for the rest of the year, and you won't have to pay anything out of pocket for your health care. That is with the exception of your prescription drugs that you fill at a pharmacy. Those are not covered by your Medicare supplement plan, and there are copays and out-of-pocket costs for your prescriptions. So this is why, according to the numbers, almost 5 million people have chosen a Medicare Supplement Plan G. But what's the catch? Why isn't it more? I mean, 66 million people on Medicare? Why have only 4.8 million chosen the Plan G? Well, the catch is that premiums for Plan G are usually a lot higher than Plan N, and a lot higher than the top 2 most popular plans I'm going to share with you today. Again, the exact premium depends on which part of the country you live in and how old you are, but generally you'll find that the Medicare Supplement Plan G is going for around $130 to $150 a month for someone who's turning 65, and it can increase to as high, well, we've seen prices as high as $350, etc. for people who are in their 80s or 90s. But for someone who's 65, it's around $1,560 to $1,800 a year, even if you never use the plan. In addition to that, the rates increase every year. Usually they go up once a year for the annual rate increase, which is to cover like inflation and the cost of healthcare increasing. And in addition to that, they usually increase once a year for age. That's why before choosing this plan, it's a good idea to look at the rate increases that have happened for the Plan G in your area before you enroll. You may find that some companies offer low initial premiums, but then they pump up the prices as you age or once you're already enrolled. Now, I want to make this very clear. I am not against enrolling in a Medicare Supplement Plan G. In fact, I would personally recommend this plan to people who have the budget for it. For some people, this is by far the best option for them. However, I just want to balance things out because you're here on YouTube, and there are too many people pushing the Plan G to all their viewers. They leave out so many details about the plan and outright bash all other options so that you feel like you have to enroll in a Medigap Plan G for decent coverage, but that's just not true. And let me tell you, it really gets me because the people here on YouTube who are pushing the Plan G and saying that it's the only option that you should consider, mostly they're doing it because it's the easy option for them to enroll you and they're padding their own pockets, or in some cases, they might not be even licensed to sell the top 2 most popular plans. So let's move on to the top 2 most popular plans. At number 2, we have the Medicare Advantage PPO plan, which has around 42,940 enrollees as we move into 2025. Now, the first thing that you need to know about this plan type is that it is a Medicare Advantage plan, which is different from a Medicare Supplement plan. Medigap Plan N and Medigap Plan G, which I talked about earlier, are both Medicare Supplement plans. Medicare Advantage plans are different because instead of acting as a secondary insurance to original Medicare, Medicare Advantage plans are your Medicare plan and they come from a private insurance company. When you're enrolled in a Medicare Advantage plan, Medicare will essentially transfer the responsibility of your health care to the insurance company that you choose. And this has several implications that you need to be aware of. First, because Medicare pays the insurance company to take care of you, Medicare Advantage plans can charge really low monthly premiums, and you'll find that many Medicare Advantage plans charge a $0 monthly premium. This also allows Medicare Advantage plans to provide much more coverage than original Medicare. Medicare Advantage plans are required to cover everything that's included in original Medicare, but aside from that, they can also give you extras like benefits for dental, vision, hearing, in some cases gym membership or flex cards, and much more. Finally, Medicare Advantage plans have a maximum out-of-pocket, which is a maximum spending limit for your health care, and generally can have really low copays and coinsurance as long as you stay within their plan's network of doctors and hospitals. You see, when you enroll in the other option, the Medicare Supplement plan, you can go to any doctor or hospital that takes Medicare, and your supplement plan will cover you. But when you have a Medicare Advantage plan, you have to stay within that plan's network. And if you get services outside of the plan's network, you may not be covered, except in the case of an emergency or an urgent situation. You also may need to have referrals to see a specialist, or you may need to get prior authorization from your insurance company before they cover certain procedures or certain medications. So a Medicare Advantage plan works very similar to how your Affordable Care Act or your employer health plan has worked throughout your entire life. So now let's talk about the Medicare Advantage PPO plans. PPO stands for Preferred Provider Organization, and when you enroll in a PPO plan, you'll find that generally they are less restrictive in their networks. PPO plans have in-network and out-of-network coverage. So generally, PPO plans will allow you to go to any doctor that takes Medicare, but if it's a doctor that's out-of-network, you may have a higher copay. In addition to that, PPO plans usually do not require referrals for you to see a specialist, but they may require prior authorizations for certain treatments. So generally, you'll find that PPOs will have slightly higher premiums and slightly higher copays or coinsurance than you'll find on their HMO counterparts, although generally they're a lot less expensive on a monthly basis than a Medicare supplement plan. You'll also find that PPO plans generally have higher maximum out-of-pocket spending limits. Remember, the maximum out-of-pocket limits simply means that that's the maximum amount that you can spend in deductibles, copays, and coinsurance before your insurance takes over and covers everything for the rest of the year. So if you're on a Medicare Advantage plan that has a $4,000 maximum out-of-pocket limit, that means that if you ever hit that maximum out-of-pocket of $4,000, your insurance company will take over for the rest of the year and you're done paying copays and coinsurance. So with all of this, like the low premiums and the extra benefits and maximum out-of-pocket limits and the flexibility to go in or out of network, over 15 million people have chosen this type of Medicare plan for themselves. But it's still not quite the most popular plan. Now, before I tell you about the #1 most popular Medicare plan in 2025, let me just jump in here and say that if you're finding this video helpful or interesting, please leave a thumbs up. This not only supports our channel, but it also helps this video to reach other people who should know more about their Medicare options and not just feel like the Plan G is the only good option for them, which is what you hear all the time here on YouTube. All right, let's get back to the video. The #1 most popular Medicare plan going into 2025 with around 19,145,560 enrollees is the Medicare Advantage HMO. Now here on YouTube, this is the hugely controversial plan. This is the exact plan that so many YouTubers are trying to make you believe is awful and that you should never, ever come near. However, there are very good reasons why this is by far the most popular plan type in the market today. I mean, remember, YouTubers are telling you that you should enroll in a Medicare Supplement Plan G, with 4.8 million people choosing that. But when you look at the Medicare Advantage HMO, 19 million people have enrolled in that, and with the PPO, an additional 15 million people in the PPO. Well, that means that over half of the people who have Medicare have chosen something different than what all the YouTubers here are telling you that you should do. So I think that warrants a closer look. HMO stands for Health Maintenance Organization, and if you're someone who's coming from employer insurance or from Affordable Care Act, Obamacare insurance, you'll find that Medicare Advantage HMO plans are similar to these in several ways. First, HMO plans have networks, and you have to stay in the network in order to receive coverage, which is different than what we talked about with the PPO plan. For most HMO plans, you can generally only get services outside of your plan's network if it's an emergent or urgent situation. That means if you're traveling, you could go to an urgent care. If you're out of state or out of the country and you have an emergency, you can go to an emergency room and you'll be covered in those situations. But other than that, most HMO plans will not cover you out of network. In most cases, you also need referrals in order to see specialists, and like other Medicare Advantage plans, you may have prior authorizations for certain treatments. And those are the things that YouTubers here attack the most about HMOs. They try to make it seem as if Medicare Advantage HMO plans, you'll never be able to see a specialist, and insurance companies will always decline your prior authorization requests. In reality, according to a study by the Kaiser Family Foundation, around 92% of prior authorization requests are accepted without any hiccups or delays whatsoever. And again, the ones that are declined, numbers show that in an appeal, 83% of the time the decision is overturned. So if you add all those numbers up, you'll find that you have a 99% chance that you'll be approved for your prior authorization requests, and that's something that you'll never hear from YouTubers here that are only selling Medicare supplement plans. Now, aside from that, Medicare Advantage HMO plans also have the lowest premiums in the market. There are so many with a $0 monthly premium. In addition to that, most of them have very low copays as long as you stay within their plan's network. They also have a bunch of extra benefits like dental, vision, and hearing, similar to what I talked about with the PPO, but usually even more than you would get with a PPO. And they have lower maximum out-of-pocket limits when compared to a PPO plan. So nearly 20 million out of the 66 million people have a Medicare Advantage HMO plan, and that's because if you're living on a fixed income, typically this will be the most cost-effective option that will also give you great coverage and extra benefits. So at the end of the day, does this mean that everybody should get the Medicare Advantage HMO plan? Absolutely not. The right plan for you is the right plan for you, not the right plan for everybody else. But I am here to tell you that there are reasons why over 19 million people enroll in this plan despite all of the talk here on YouTube. You see, every single plan type has its pros and its cons, and it's so important that you do your own research instead of relying on what's popular or on what a salesperson is trying to say is popular. Also, your options are going to vary depending on where you live. And in some cases, you might have a great Medicare Advantage option, while in other areas, the Medicare supplement prices might be lower than average. That's why if you need help finding the right plan in your area or for your needs, then you can call or text our team of unbiased, licensed insurance agents today at 877-360-6565. And unlike other YouTubers, our team here at PlanFit is licensed to sell both Medicare supplement plans and Medicare Advantage plans. Our agents are also paid by salary, not commissions. So there's no incentive for them to be biased towards any certain plan or plan type, and they can assist you in finding the right plan that's fit for you. That's why we call it PlanFit. Lastly, if you need more help understanding the differences between Medicare supplement plans and Medicare Advantage plans, I made a full video comparing all the pros and cons of each plan type. You can watch it right here. Other than that, thank you for watching, and I'll see you on the next one. Bye-bye.